Hello, this is Dr. Grande. Today's question is, what is major depressive disorder with mixed features? If you find this video to be interesting or helpful, please like it and subscribe to my channel. That way you won't miss anything new. So when we talk about major depressive disorder, MDD, with mixed features, we're talking about a disorder and a specifier. So the disorder, MDD, and the specifier with mixed features. There are a number of specifiers available with MDD, with mixed features is just one of them. And this is one of the more controversial specifiers we see with major depressive disorder. It's also a specifier available for bipolar disorder. This specifier is often missed, and this condition, this set of symptoms, MDD with mixed features, is oftentimes misdiagnosed as well because it's easy to confuse with bipolar disorder. I'll talk a little bit more about that controversy in a few moments. So first I'm going to review the symptom criteria for MDD with mixed features. So whenever we use a specifier with a disorder, the full criteria for the disorder had to be met first, and then there are additional criteria for the specifier. In the case of mixed features, there are a number of additional criteria. So looking at the symptom criteria for mixed features, we see that there are a number of different potential symptoms. An individual has to have 3 or more of those symptoms to qualify for the first criterion, Criterion A. That's the criterion that contains the symptom criteria. Now, these different symptom criteria need to be present nearly every day during the majority of days of a major depressive episode. And this is one of those few times when the wording about how often a symptom has to be present in the DSM is particularly unclear. There is some debate over what this means, but I think most clinicians can agree this is not a clear statement, nearly every day during the majority of days. I suppose technically that you could take any majority of the days during a major depressive episode and then look for symptoms that are present nearly every day during that majority of days. Again, this is a bit confusing, a few different ways to interpret it. A lot of clinicians just look at this as 51% of the days in a major depressive episode. That's not technically, of course, what it says, but because it's confusing, I can understand why that's done sometimes. So looking at the symptom criteria in Criterion A, we see elevated expansive mood, grandiosity or increased self-esteem. We see being more talkative or being pressured talk, like pressured speech. We see a flight of ideas or racing thoughts, increased energy and goal-directed activity, specifically in the area of social relationships, work, school, and sexual behavior. We also see engaging in activities that have a high potential for painful consequences and a decreased need for sleep. So this is when someone feels rested with less sleep than they would usually have. So again, at least 3 of those 7 symptom criteria would have to be met. So that brings us to Criterion B. And this says that this behavior is observable and represents a change from the usual behavior. Criterion C indicates that if the full criteria for mania or hypomania is present, then the diagnosis of bipolar I, that's for mania, or bipolar II for hypomania should be made. So again, this mixed feature specifier is often confused with bipolar disorder. Criterion C tries to clear that up somewhat. Then we have Criterion D, which says the symptoms are not attributable to substances. So there are several characteristics associated with mixed features that make it different than what we might see with other specifiers or MDD without any specifiers. We see that mixed features are a significant risk factor for developing bipolar I or bipolar II disorder. Now we know that oftentimes with bipolar disorder, an individual who has that disorder would have started with a major depressive disorder diagnosis. So some of the presentations of major depressive disorder are later re-diagnosed as bipolar disorder as more symptoms are observed. So this mixed features specifier is a significant risk factor for developing bipolar disorder. We also know that mixed features aren't rare. About 25 to 40% of individuals with major depressive disorder would qualify for the mixed features specifier. Other characteristics associated with the mixed features specifier include increased risk for suicidal behavior, increased use of substances, a poorer response to treatment, an increased number of major depressive episodes, and an earlier age of onset of major depressive disorder. So I mentioned earlier that there's some controversy around this specifier, and the specifier is sometimes missed and misdiagnosed. And the controversy really revolves around the distinction between major depressive disorder and bipolar disorder. There are those that believe that this mixed features specifier shouldn't exist at all, and if these symptoms are present, this should really just be bipolar disorder. And there are other individuals, other researchers who believe that this specifier was long overdue, that it should have existed a long time ago, and it's important clinically. In my opinion, this specifier is useful because it does represent a distinct set of symptoms that we sometimes see with MDD, and of course, as I mentioned before, it's a risk factor for bipolar disorder. So it does seem to have clinical importance. Although the way this specifier definition is worded really needs improvement. This really highlights the need for a mental health clinician to carefully look at all the symptom criteria and other criteria and compare those to the definitions for hypomania and mania. I hope you found this description of major depressive disorder with mixed features to be interesting. Thanks for watching.